Hello and welcome back to Patient Knowledge. I'm Dr. Kirmani, and today I'm going to be talking about a common condition in children, bedwetting. So let's get straight into it. Bedwetting is also called as nocturnal enuresis. In this video, I will be giving you some information as to what is normal in bedwetting, what causes it, when one should contact their doctor, what are the treatment options available, and how the parents should treat their child to cope with this problem. Now, what's normal in bedwetting? Bedwetting at night is common in children up to the age of 5. About 50% of 3-year-olds wet their beds, as do 20% of 4-year-olds and 10% of 5-year-olds. It's considered a problem if regular bedwetting occurs in children 6 years and older, although many boys do not become dry until 8 years. Bedwetting that happens after a long period of good toilet training with dryness is called as secondary enuresis. Now, what's the cause of this? There's usually no obvious cause, and most of the children are normal in every respect. But some seem to have a delay in development of bladder control. Others may have a small bladder capacity or a sensitive bladder. It tends to be more common in boys and seems to run in families. Now, most bedwetting episodes occur in a deep sleep, and so the child cannot help it. The cause of secondary enuresis can be psychological. It commonly occurs during a period of stress or anxiety, which can happen during a separation from a parent or is arrival of a new baby. In a small number of cases, there's an underlying physical cause, such as an abnormality of the urinary tract. Diabetes and urinary tract infections may also be responsible for bedwetting. Now, when one should contact their doctor? Seek help if bedwetting is beyond 6 to 7 years of age, daytime bedwetting, and bedwetting starting after a year's dryness. Now, what are the treatment options available? Many methods have been tried, but the bedwetting bell and pad alarm system is generally regarded to be the most effective. If the child has emotional problems, counseling or hypnotherapy may be desirable. Now, drugs can be used and may be very effective in some children, but they do not always achieve a long-term cure and have got some limitations. A new agent called desmopressin, which is sprayed into each nostril at night, seems to be very effective if the alarm system is ineffective, and this can be used when the child wishes to go on a camp from school or wants to have a sleepover. Use a star chart progress. This works wonders. Treat constipation if your child has it. Now, how should parents help their child cope with this problem? Here are some suggestions. Remember that it's not your child's fault, so be supportive, be positive. This helps them psychologically. Bedwetting can have a significant impact on their self-esteem and their overall personality, so do not scold them or punish them. In fact, praise the child when appropriate. Do not limit their water intake in the evening. Do not wake the child at night to visit the toilet, and use a night light to help the child who wakes up to go to the toilet. Try using special absorbent pads beneath the bottom sheet instead of a nappy. And make sure the child has a shower before going to school, kindergarten, or daycare. Now remember, bedwetting is not the child's fault. Rarely it has an emotional cause, and it gets better naturally. It nearly always clears up before adolescence, and it requires a gentle, non-interfering approach. It responds well to an alarm from 7 years. That's all for today. Thank you for listening. I hope this information about bedwetting was useful in understanding what are the causes, and how to manage bedwetting effectively. If you want more of such kind of videos, support my channel by liking, sharing and subscribing it. If you wish to hear something, leave it in the comment box below. Bye for now.